Whoa, hey, it's you again. Seriously, how the heck do you keep getting in my house? One of these days I am really going to have to figure that out. Well, in case you forgot, obviously I'm John. I haven't changed and I'm still a Bernie supporter. Now, since you're here, I might as well tell you about how our corporate-run healthcare affects the economy and society in general compared to how Medicaid for All will affect these things. This way you'll get a good idea of how life is going to change and how things can actually be better. Crap! I keep forgetting about the darn slides because now I can't see you again. Well, that's all right. You're probably looking at the first slide there, which talks about how right now with our corporate-run healthcare, medical bills that are completely unaffordable causes families huge amount of stress. Quite frankly, that's a whole lot of divorces because the number one reason why people divorce is over money. So if you have a lot of bills you can't pay, that's going to cause you stress. You're much more likely to get divorced that way, which obviously affects children as well. Also, when you have really high monthly premiums and deductibles, you are literally sucking money out of the economy. The more money that is in your pocket, the more money you have to spend at businesses, which means the more money they make, the more they grow, the better off everybody is. Also, when you have high costs for employers when it comes to health insurance for their employees, that is also sucking money out of the economy because they can't afford to grow their businesses or pay their employees anymore. It also affects the profits of these companies as well. So if you lower health care, you're going to make everybody happy. Not to mention the fact that most uninsured people do not go to the doctor very often. That means they tend to be sicker and die from preventative illnesses they would not have normally died from. Also the fact that you tend to have a lot of high rate of untreated mental illnesses. Quite frankly, here again, if you don't have insurance or your insurance isn't very good, you're not going to go to a doctor to get diagnosed with a mental illness, which means you're much more likely to end up homeless and even possibly be violent. And the last thing is, when families have to choose between drug prescription prices and their bills, they're going to choose their bills. That means they're also much more likely to die of a preventable death, be much sicker, and of course that is also going to affect families and the economy. Oh, hey, what's going on? I see you're back again. Did you lose weight? Did you happen to get a haircut? And you sure are looking good. You know, it really could be that you are less stressed due to the thought of Medicare for All. Well, after you see the next slides, you'll probably feel even better about Medicaid for All. And speaking of the next slides, there you go, you're gone again. You're probably looking at the blue slide right now, which, speaking of, talks about how you're going to have a lot less stress because you're not going to have all these high medical bills to have to deal with, which obviously keeps families together and is going to drastically reduce the divorce rate. Also, with more money in people's pockets, it's more money going into the economy. Businesses will have more money to spend. They will make more profits, and people will have more money to save in general. Now, also, you're going to have more money for employers as well, because obviously the less money they pay, the more money they can invest in employees and growing their businesses. The really good thing is you're going to have a lot less people dying from preventable illnesses because they're going to get checkups more often since they'll be able to do it for free. And the 30 million people right now that don't have health care will have health care, so they'll get those checkups that they're not getting right now. We will drastically reduce the homeless population as well, because what most people don't realize is a huge chunk of homeless people are mentally ill and do not get the treatment that they need to help themselves. So guaranteeing that they have health care and a way to get mental illness prescriptions will definitely benefit them. And the last thing, of course, is when you don't have really expensive drugs to pay anymore, that means that you can pay all your bills, have a little bit left over for the family, which obviously everybody will be happy with. And oh, hey, I see you're back again. Well, I'm really glad you didn't get lost. Well, if you happen to look up here, or you happen to look up here, you will probably see links to my next videos. This one right here is going to be the next video, which will actually talk about how we're actually going to pay for all of this stuff. And it's going to have quite a little surprise in there for you, so definitely check that video out. This video is actually my previous video, so that way if you didn't watch that one, you definitely want to check that one out as well. And please remember to vote for Bernie Sanders, watch my next video, or get the heck out of my house and have a good day.